Let's go live now to Dr. Joshua Mugel, Associate Professor of Emergency Medicine at Indiana University. Thanks for joining us this hour. I believe you were in Liberia when its first Ebola patient was hospitalized. How equipped is the healthcare system there to handle these outbreaks?
Well, thank you for having me. Unfortunately, I think even before Ebola hit Liberia, because of the civil war that was there, the healthcare infrastructure was pretty minimal. They do have a lot of well-trained doctors and well-trained nurses, but just a very small percentage compared to the population there. The drug supply there, the glove supply, the personal protection equipment was at a shortage because they're dealing with normal and endemic diseases all the time. They have AIDS, they have malaria, they have tuberculosis. And so when you add on something as bad as Ebola on top of it, it just already taxes a very stressed system to begin with.
What about the Western world, though? Because Ebola's been around for 4 decades. Why is it that emergency medicine in the West was apparently not able to handle the virus properly?
Well, I'm not exactly sure about the cases that happened in Dallas, but anytime you're dealing with a highly contagious, highly infectious disease, there's always risk. But we face those risks every day. We face those risks when we're dealing with tuberculosis, when we're dealing with HIV, when we're dealing with hepatitis. We face those risks. The difference with Ebola is that it has such a high mortality rate so early on. So to say that the Western healthcare system is unprepared, I think is not exactly true. I think, accidents can happen anywhere. I think we are prepared to deal with outbreaks. Nurses are trained on universal precautions all the time. It's just a difficult disease to contain.
But do you think more steps could be taken now to raise the readiness of emergency services to this crisis, because it does seem to be spreading?
I absolutely agree, and I think the biggest thing that can be done is awareness and cooperation among communities. The whole line with emergency preparedness is the more robust and the more prepared a community is at the beginning, the more easily and more competently they respond to a crisis. And so I think that the main thing is just awareness and heightened sense of the lethality of this. And when people come to the emergency department, we just need to have a heightened sense of awareness of it. There is room for training for the specifics of the PPE and the gowns and the gloves with Ebola. But as I said, nurses and doctors deal with infectious disease and deal with dangerous situations on a day-to-day basis, even before Ebola came to the U.S.
How dangerous can this epidemic actually become, in your opinion?
Well, obviously it's a human crisis, and it's a tragedy for the people of Western Africa, and that's the greatest sadness in this whole thing. And eventually, I mean, it will kill more people, and more people will be infected, and it's going to grow. But I have confidence that it will eventually be stopped. I think the biggest tragedy in my mind is the devastating effect it will have on the infrastructure of these West African nations. And so an already stressed healthcare system will lose doctors, it will lose nurses, there is going to be a food crisis in Liberia because of the restrictions on travel. And so even once Ebola is gone, people will still need to have babies and will still need care for their HIV and still need care for their tuberculosis. And the systems that are in place already, I think, will be even worse than before. And I think that's the biggest tragedy here, is the long-term effects that Ebola is going to wreak on that region of the world.
Dr. Joshua Mugel, Associate Professor of Emergency Medicine at Indiana University. Great to get your take this hour. Thank you for joining us.
Thank you very much.